Here we go. Well, welcome everybody, and thank you for tuning in to chat here. My name is Jonathan Kukor. I am an acupuncturist in Orlando, Florida, and I am joined by my colleague Stella, who's in Texas, and I can't remember exactly where in Texas are you, Stella?
West of Houston. I'm Katie.
Katie. Okay, awesome. So thanks for doing this chat here today. So tell me a little bit about what your practice is like, and I don't know, your experiences with acupuncture.
Sure. Let me give a little introduction for the audience that I have. So this is John Kukor. Did I pronounce that correctly?
Perfect. Yes. Thank you.
Okay. Based out of Florida. We're in Florida?
I'm in Orlando.
Orlando, right. Sorry, forgot about that.
Oh.
Yes. Busy place.
Yes.
So he specializes in pain and orthopedics, and he is here to talk about whatever comes up. We're just having a friendly conversation to get to know each other better. And I want you guys to know that he's available in Orlando. He's a very well experienced acupuncturist, and he is available taking patients right now. So if anybody needs him, he is practicing. So tell me, John, how did you, you asked me a question. What was that?
Yeah. I don't know. I just figured we'd start off if you wanted to talk a little bit about your practice. I know right now due to COVID, things are kind of limited for you right now, but like in normal times, I know beforehand we talked about you've got a strong interest in kind of stroke rehabilitation, something that piques your interest as far as acupuncture. And I mean, I think that's something that people don't normally think of with regards to acupuncture. So I think that's pretty cool.
Yes, that is my ultimate goal. Let's put it that way. Right now, I don't consider myself as a specialist in stroke or neurology, but I'm taking the trainings and doing everything to do that in a couple of years. Right now, I'm open to treating. Most of my patients are like pain, and I have a lot of veterans that come with pain and some neuropathies. I also have anxiety patients a lot. I don't know why, but they gravitate towards me and they spread the word of mouth, which I love. And I'm able to help a lot of anxiety patients. So if I would have to choose, like, what am I specializing these days? It would be in that. But I can treat also, of course, like all acupuncturists, we can treat many things.
Yeah, absolutely. Well, we definitely need you open right now because I mean, I highly doubt anxiety worldwide has been higher than it is currently.
It is. Actually, I have a couple of my anxiety patients texting me, when are you going to open? When are you going to be back? And things like that. Because right now I am not open. I'm not practicing because I work for a health spa and the orders for the spa is to close down. So hopefully we're opening on the 18th and things will start going again.
Fingers
And you've
crossed.
been practicing all these days since COVID, the whole full time, or not?
No, I was closed down for I don't know, I want to say at least 5-6 weeks. There was an order put out by the governor and through Florida acupuncturists and different online chat forums that we have. There was debate whether we could be open or closed, and a lot of us felt like we should be closed, and some people stayed open. Some people felt it wasn't very clear. I felt like I was playing it on the safest way possible if I stayed closed for a bit. So I'd stayed closed. I'm instituting different PPE things, which are sometimes interesting to acquire the materials nowadays because they're so limited. But yeah, I pretty much this week I've opened back up and have instituted additional measures for patient safety. And it's a little bit of an adjustment, but it's good to be back and helping people. And it's difficult, I think, for a lot of people to get into a Western practitioner right now because, especially in some states, like my father's in Virginia, I want him to go in to get something looked at, and he was like, "Well, my HMO that he belongs to is only seeing COVID people right now," and I'm like, Well, that's kind of crappy because he has a pretty uncomfortable situation that he needs dealt with. So I think it's great that we have the ability to potentially take some of that load off and help people that can't get care that they need.
Absolutely, I agree with you. And also, at least here in Texas, all the non-essential activities, operations, surgeries, and medical practices are not really doing much right now. But that has been like suspended. I did read in the news a couple of weeks ago that they should have been opening this week. I don't know where that is, but yes, doctors are going to be opening their offices this week too. So, John, tell me something. How did you talk to me about your specialization of pain, orthopedic, sports acupuncture? How did you decide that that was the way you wanted to go?
So it's kind of interesting. So originally, the main reason that I got into, or I won't say the main reason, the thing that I really thought I would be into when I started this journey to become a licensed acupuncturist was sports. I've grown up playing sports. I've always been very active. I've been a big fan of sports, and if you play sports, you're going to get injured. It's just the nature of the beast. Or, whether you're a weekend warrior, you're a professional athlete that's big time, we're all going to get hurt. And finding better ways to recover, to improve performance, that was something going into acupuncture school that I really hoped for. And I think the consensus now that I've been out of school for several years, talking to everybody, not every school, but the majority of the schools, they pretty much gear you to get you through licensing. And you do get some knowledge to be able to practice, but especially if you want to really specialize in something, it requires a lot of work postgraduate to really dive deep into that material. So I actually, through one of the groups and on Facebook, it's called Chinese Medicine That Works. It's a pretty popular group. They do a lot of continuing education. I ended up taking a class several years ago down in South Florida in Fort Lauderdale. There's an acupuncturist who's in New York City named Richard Hazel there, and he was teaching a class on motor point acupuncture, which is a specific type of acupuncture. Probably familiar with it, but just for those that are watching, so you take a little handheld device, or you hook up another type of electric stim unit, and you insert the needles in a region that will stimulate the motor nerve. So what that does then is it elicits a contraction in the muscle. It's not painful, but it's a little bit of a different feeling, but it works really well. So coming to talk to Richard at that class, some of the schools in New York had specialized orthopedic training, which I was not introduced to in my graduate studies. So it felt a little behind the ball when I got into class. It was kind of overwhelming, but at the same time, just amazing stuff that I was introduced to. So that just kind of got me thinking and pursuing other avenues. So I worked on the techniques that I learned in his class and kept studying that and figuring out more stuff I needed to study, and a lot of anatomy, because I learned quickly that my anatomy was not really up to par where it needed to be with very specific orthopedic examinations and treatments. So I got into that, and then I don't know about in Texas, but here in Florida, throughout my acupuncture career and when I was in school, there have been heavy debates about something called dry needling.
Yes.
And up until recently, physical therapists were not allowed to perform it in the state of Florida. And there was a lot of fight back, and a lot of acupuncturists almost had bad feelings towards a lot of physical therapists, I feel like, which I definitely was not on board with that aspect, but I heard a lot of negative as far as the term dry needling and injuring patients and all these things. So I wanted to find out more about it. So I talked to a couple of colleagues who had received specific training in it, from a physical therapy group. The group is called Myopain Seminars. And so I did a little research on that, and they are arguably the best training worldwide in dry needling. They are run by a gentleman named Jan Dummerholt, who's a physical therapist, and he worked directly with an MD in the 20th century, Janet Bell. Are you hearing me okay? I'm getting a little feedback. Yeah, okay.
Yes, I can hear you.
Okay, awesome. So Janet Travell, a lot of people probably don't know of her. She did extensive research about myofascial pain, and what the myofascial just means is basically muscle and connective tissue, and pain referrals. And pain is not as simple as very often people think. Oh, well, my elbow hurts, just put a needle right there.
Right.
Like that's, those that are not trained many times think that way. Sometimes local needling does help, or some sort of localized treatment, but looking at the body more as a whole in different ways, trigger points, and without getting too deep into that, it's a lot more complicated thing. So long story short, I ended up studying under Jan Dummerholt. I did their entire dry needling program, went through it, got tested afterwards. And I feel like as far as anatomy, orthopedics, that really took my game to the next level. And I've kind of continued on that with some self-study. There's some people that I follow online. There's a physical therapist named Brent Brookbush that use a lot of his material. Anthony Lombardi is a Canadian chiropractor who does mainly acupuncture, actually. I've done a ton of his trainings, and just kind of like done a synthesis of all of them. And it's a continuous learning curve. I mean, no matter how good you are, you will never know everything. And if you want to be good, you just have to continue hammering away at it. I mean, that's how you get good, so.
That's right. And particularly, that's one of the things that I enjoy about being in this career. I know many careers have it too, but you have to be on top of things all the time, and the new research that comes out, and the new techniques and diverse techniques, because day by day we are putting some modern swing into the traditional Chinese medicine, and it's working really well most of the times. And I love that part, because I'm a lifetime learner. I love to do all the training I do, and I really enjoy it.
Absolutely.
So tell me about you a little bit personally. What is Jim Cooker like when he's not taking patients?
So I really try to lead a pretty healthy lifestyle. So I don't know if we'll get back to normal times anytime soon, but let's talk about. I'll go back to then, a few months ago. So I generally try to practice yoga a few times a week. I have off and on done kickboxing training for years. I work with a local MMA gym doing that, and a trainer there who I've known for years. Cooking, staying pretty active, trying to adhere to a lot of the things that tell patients regarding sleep and stress, and good things to keep in balance as far as that. Because, I mean, if you're out of whack as a practitioner, it's just going to reflect in your practice. And you really have to be there mentally and physically to be able to really give the best in your treatments, I feel.
Yes, I feel that way too. I try to also as well walk the talk.
Yeah.
Definitely practice the best nutrition.
I've lost your audio here for a second. You can hear me? No? Let me
Not
see.
yet.
You're back. You're back. Okay.
Okay.
There you are.
Well, these are the beauties of being recording right and live. So we were just talking about like walking the talk, that
Yeah.
we have to take care of ourselves, because if not, we are not able to take care of anybody else. And that is, for me in my life, it's an absolute truth. You know, you do have to take care of yourself first. That's why I finally understood, it took me a while. I finally understood why the flight attendants always say, put your oxygen mask first and then help someone else. And I'm like, but that's your kid. I'm like, no, that's how it works. Yes.
I absolutely love that. Like I have been using that. I can't tell you for how long, and I never have heard anyone else repeat that. But like I tell that to patients, I do that all the time because I mean, you take that and just like you said, like you apply that to so many different aspects of your regular life. Like I was a caregiver for my mother for a while. Like in those situations, if you are a mother and you have children to take care of, like you know, so many things. I absolutely love that analogy.
Thank you, thank you. Yeah, I
Yeah.
use it all the time as well because I just couldn't understand. I used to travel a lot, and every time it just boggled my mind. I'm like,
Yeah.
okay, why? It's always children first, and I don't get it. So until I really started getting into Chinese medicine school
Yeah.
and understanding how important it was to take care of yourself first in order to have all that special, it's not special because everybody has it, but all that ability and all the knowledge and the energy and all the mental state and everything that we need to have to take care of others, it didn't click to me until I understood Chinese medicine that that is the reason why we definitely have to take personal care first and then take care of others. And it has helped me for a long way because I've noticed that sometimes when I'm coming down with allergies or something, if I miss the window, you know, we treat allergies mostly
Hmm.
ahead of time
Hmm.
before they come up.
Hmm.
That's the best way we do. For those that are listening, we start sending herbs and giving acupuncture a month or so before allergy season hits. If for any reason, because I neglected myself and I didn't get into that window, I get the consequences of it. And it is really annoying having to take care of patients having allergies because for one, these days it should be really bad because everything going on, it's like, okay, what do you
Oh yeah.
have?
Yeah.
Do you
Yeah.
have allergies? Do you have what is going on with you? So definitely don't want to do that these days.
True.
But yes, it is pretty good.
Yeah. No, that's awesome. I had a question. I want to step back real quick because I thought this was interesting. So you'd mentioned previously that you see a lot of veterans, and I know I have worked with a lot of veterans as well. And I don't think a lot of people that have not had that experience really understand what that's like. I don't know what your experience as far as has been, but me previously, they have been some of the most interesting cases I've seen. And I have found it very rewarding because many times it's a population that just has not received answers and, you know, has had potentially pain that has just been so debilitating. All aspects of their life are impacted. And obviously everybody responds differently, and I am not going to say I get 100% results 100% of the time. I try my best, but for those patients where you get those really amazing results, I think there's nothing like it. What has been your experience with the veteran population?
My experience has been like that as well. I have a deep feeling of gratefulness to the veterans and to all the military in general because I grew up in Venezuela, and Venezuela is going through a really bad political situation right now. And being able to come to my country again and having my children grow up in a free country and a democratic country means so much for me. So also, besides that, my father was in the Air Force, and my uncle was in the Marines. So I do have a little sweet spot for veterans, and that was something that I wanted to do as soon as I heard that the VA was having acupuncture. So I worked my way, I got certified, and I was treating it. And the most interesting stories come out of them they don't like to talk much about their personal experiences that are not pretty, but their life experience is just amazing.
Yeah.
Like, I remember I had one of them come in, and he came in for back pain. But as well, he was telling me that he couldn't feel his feet very much and that they were going numb. So he came in with a walker. And by the fourth treatment, he was amazed that he was only walking with a stick, with a walk stick. And the first one thing that really happened pretty that I took my heart to heart is that the first treatment, I worked with him on his back pain, and then I went and I worked on his neuropathy for the feet to see how that responded. So after that, I discharged him and everything. He came in and he says, I want you to know that I don't believe in that. I don't believe in what you do. But I'm here because I'm disciplined and I'm going to follow instructions and I'm going to complete my sessions. I was like, okay, well, that's a good start.
Yeah.
Okay, disciplined, I will take that. You're going to give me the time. That's okay. You don't have to believe. I'll make you a believer. So after the first treatment, he's like, I'm like, okay, how do you feel? Well, I think I'm a little bit better, but I'll tell you in a couple of minutes. Let's see if this lasts a couple of minutes. I'm like, okay, no problem. So I discharge him. He goes, he sits in the lobby. I take another patient in. And when I come out from the other patient, this gentleman, he's still sitting in the reception. And I'm like, oh my God, what happened to him? I'm like, okay, Mr. M, what happened to you? Why are you still here? Is there anything wrong? Are you feeling bad? Can I help you in any way? And his words were literally, well, I'll be damned. I can feel my toes.
Oh my God.
That perfect Texan accent. So that story, that was my first veteran ever. And that story got me for like forever.
Yeah, that's amazing.
Yes, and he has, of course, every veteran has their own journey, and they are mostly very frustrated because many of their ailments and aches and pains and what they go through, they don't have a Western cure or a Western way to diminish it other than maybe painkillers or things like that, or medications that give you side effects that you need another medication for the side effect. I've had some on lists of 20 medications just for other medications and things like that. And with acupuncture, they have understood that it's a natural way, and many of them have been able to, with their doctor, cut back some medications, and they're very happy about that. They say, well, I like that you take into account things that are not important for Western medicine, like my annoying night sweats. I have night sweats. And the Western medicine just as well, live through it, nothing bad. So, okay, but in acupuncture, for us as Chinese medicine practitioners, we know that when you have night sweats, we have to tonify a little bit here and a little bit there and use certain points. And hopefully, most likely, they will go away. And that happens. So they are always grateful for those little side effects that they come, not side effects, for the little ailments that they come besides their main chief complaint. They're always very, very grateful for that. How has your experience been?
Yeah, I mean, kind of the same thing. I mean, I definitely have had multiple veterans come in, kind of like your first veteran. They're like, well, I don't know. They send me here. I'll give it a try. And I can't even tell you how many people I've seen start off with that attitude. And then as quickly as 3-4 treatments in, they're like, wait, when can I go back? Like, they're just so excited for the results and how much better they're doing. And, you'll get some of the same, especially initially. Oh, I don't believe in this. I'm like, doesn't matter what you believe in. I don't care if you believe in the tooth fairy. Like, that has nothing to do with the efficacy of this. You don't have to believe in it for it to work. But yeah, I've had quite a few of those. Probably my favorite veteran story this was pretty early in my career. I remember I was working as associate at this one clinic, and I'm looking over the intake form, and this guy has literally like almost everything checked off as far as problems. And I'm like, I don't even know where we're going to start here. Because like, I like to, look over things, then go in the room, talk to the patient about it. So I go in and we start talking. So he was a mechanic, I believe in the Air Force, and he was doused in jet fuel. And for about 45 minutes or an hour, he was covered in jet fuel. And just
Wow.
the toxicity that developed in him after that. And unfortunately, the military and the doctors that he saw at the VA, based on what he told me, just kind of blew off everything that he said. Um, so he was, I feel like, kind of near the end, if you will. Like he was probably going to take his own life. It reached that point.
Oh, wow.
He
Okay.
was he was in so much pain. Like it was almost kind of like fibromyalgia, just non-specific body pain all over the place. And so I looked at it, I was like, okay, well, let's start off with this. So I did some really simple treatment the first time. I think I did like the NADA protocol in his ears, just based on everything I saw. I was like, let's do this and maybe some very simple basic body points, like 4 gates or something, like just like maybe 4 to 6. I don't remember exactly what I did as far as body points, but I definitely did the ear points. He came back in, I think 2, 3 days later, and he brought his wife with him. And she said, she was like, I wanted to come in because I wanted to thank you so much, because I was about to leave him because I was just so fed up with what a miserable person he was and how bad he was. And she's like, I can't even like thank you enough.
Wow,
And
that's giving me goosebumps.
yeah, like it was, I was blown away. I mean, the medicine works, but a case like that, and how complex it was, I was not expecting like that quickly to have such a change. Um,
Right.
but it was awesome. And really quickly he responded and was like super happy and got his life back. And just stuff like that, like I think is super cool, especially where somebody's at a position where they've just given up on life and they just think there's nothing that can help them.
Yes, it is. It is. For me, every patient, it's gratifying to help them. Every patient, no doubt whatsoever. But with the veterans, it's like, just because they're veterans, they have a story that you kind of say, okay, you've been through a lot, which I guess we should assume that from every patient. I don't, and that's my bad. That's a good idea. I will take that from now on. Assume that everybody has gone through a lot. But with the veterans, it happens to me that, okay, oh my God, you've been through a lot. That if I can give you a little bit of relief of whatever's going on with you, I will feel wonderful that you feel better somehow. And that feeling, I will extrapolate it to my patients because I always want to help them feel better, but I have not noticed until talking to you right now. Thank you for that insight.
Yeah,
That mental state, we have to think that everybody went through a lot of in their life. Yes.
very good point. Yeah.
Okay. And besides orthopedic and pain and sport medicine, is there other area that calls your attention or that you started with, or you always, well, you mentioned that you wanted to do that since you were in school
Yeah.
because of your sports and all that, but did you diversify into other things before you went into the sports medicine?
I'd say that has been my primary focus. However, as like I've continued this postgraduate path and been exposed to different things we can do, because I really had no idea starting out what we could accomplish with acupuncture. I mean, I'd received it as a patient a little bit, but in school they tell you things and they're like, oh, well, this does this, this is that. I'm like, does it? Like, even to this day, I still remain somewhat skeptical of some things. Like, I know acupuncture works, and I know there are a lot of great things that I can bring to the table, but until like I really understand and can really see, okay, yeah, this treatment, okay, this is gonna do something. Like I want to really know. I don't want to just be like, oh yeah, I just stick this one needle, in your shoulder, and like I'm like Harry Potter. I can just come out and wave my little wand and everything's okay. So to answer your question, yeah, I've studied with, there's a gentleman in New Jersey named Andy Rosenfarb who specializes in degenerative eye conditions. Um,
Yes.
I've done some trainings with him. I have not really put it out there as far as marketing wise. That's on my goals of things to accomplish here very soon, because people, again, another population that for certain conditions, like diabetic retinopathy, people can lose their eyes, or not their eyes, but their eyesight with
Yeah.
diabetes. And they're not given a lot of hope again, or a lot of treatment options. So that's something that can be work very well for that. Cataracts, macular degeneration, like there's a lot of different possibilities that it can really help patients for. So that's very interesting. I did a class in the last 6-7 months with Isla Wolf, who was trained at the Herrick Institute, which is actually down here in Florida. And she did a class on concussion and traumatic brain injury. And that really appealed to me. It kind of like blew my mind. I was like, oh, wow, all this neuro stuff, I got to really study this and hit it hard. So I need to dive deeper into that. But my plan is to take some of the testing. She showed us a lot of functional tests that you can do, because people, whether you're an athlete or you get injured on the job or whatever, you might suffer a head injury, and this could be something that affects you for life, but that's your new norm after you suffer the injury. So you don't know, because you're living in that state. You're like, wait, there's something wrong with me. Like, you don't know until somebody actually breaks it down and shows you, hey, your eyes are not following my finger, this eye is all over the place, this is something's off here. So it's really cool. And then I talked to I worked with a few of the soccer players for the Orlando City team last season. And I was talking to them, and a lot of people in this country do not really understand what a contact sport soccer is. A lot of physical contact, and just like American football, soccer, you can get a lot of head trauma. So the team doctors are the team doctors. What I've come to realize as far as working with athletes, that they're paid by the team. The players are employed by the team to get out there and produce. I'm not saying there's anything evil or anything like that, but generally to seek care that really is in the athlete's best interest, they have to a lot of times go outside or to get specialized care, which is why they'll come to acupuncture on their own. And with regard to something concussion, I mean, obviously the team doctors want them to be safe, but at the same point, they do want to get them back out in the field, especially like NFL is a big moneymaker. You want to get your players back out there. And I mean, the NFL is in all these lawsuits, I think, still, as far as brain injuries and all these other things. I mean, it's a nature of the beast as far as football. Like, it's going to happen. It's not a good thing, but instituting things to increase safety and then different treatments, I found very interesting. So I'm trying not to go all over the place here, but the concussion TBI thing is definitely something we can help with as far as acupuncture, and try to restore some of the previous norm, which I don't think a lot of people know about. And then kind of along the lines of that, neurologically, stroke rehab is something that I hope to incorporate into my practice in the near future as well.
Okay, great. We'll be able to refer even more patients to each other then.
Yeah, totally. I think it's really exciting.
Absolutely. Well, John, we have been talking for almost an hour.
Wow. That was
right?
it. Yeah.
I know. I
Yeah.
was like, my phone gave me a little time, and I'm like,
Yeah.
no, this can't be the hour time. And yes, it was.
No, that's awesome.
So,
Yeah, is there anything that that you feel you really wanted to include before we wrap up here?
well, basically, that I'm Stella Stoufer, a licensed and board certified traditional Chinese medicine practitioner. In the modalities, we have acupuncture and herbalism, and we also have cupping and other techniques that we can help you with. I'm located in Katy, Texas, and you guys can contact me at S. Stoufer for Stella Stoufer, S. Stoufer at clinicalacu.com.
Awesome. And I'll
How
be
about you?
sure when I post the video on my side, I will be sure to put your information in there too, that so people can reach out and get to you as well. And then I am Jonathan Kukor, licensed acupuncture physician in Orlando, Florida. And you can find me at orlandoalternativehealth.com. And thank you for checking this out. I had a good time today. Thank you, Stella.
That's right. Thank you, John. I'll see you soon.
Okay, awesome.